Welcome, everybody, to today's webinar on year-round marketing strategies for Medicare and health insurance. My name is Patrick Stevenson, broker manager at Lori Life and Health, and I am especially excited for today's session in our Medicare Bootcamp series. Today, my hope for all of you is that you walk away with some valuable next steps and actionable items and ideas that maybe you haven't thought of before to grow your business throughout the year, not just during the annual enrollment period. Our goal is to help you increase enrollments, definitely an obvious goal, but we also want to equip you with some strategies that can connect you with individuals who truly need your guidance so you can become a trusted advisor in the community that you work. A couple quick housekeeping items before we jump into it. On the right side of your screen is a control panel. One of the drop downs in that panel is for you to ask questions. We encourage you to ask any question that you have throughout the presentation today, and a member of our team will be sure to answer those at the end. If you have a question you want to talk more in depth about at the conclusion of today's presentation, feel free to give our office a call. You can call us at 803-256-2067. And just in case you missed that, I will give you that number again at the conclusion of today's PowerPoint. So thank you all for attending, and let's jump right into it. For our agenda today, I'm going to start by giving you an overview of Medicare and health insurance, a quick refresher there. Then I'm going to throw things back to business school and give you a little marketing 101, which will include marketing channels, branding, as well as a few other nuggets. Then we're going to talk about compliance reminders to make sure you are following all the rules with CMS. And then I want to talk about next steps of how you can put the things that we discussed today into action. This chart does a great job showing exactly what type of plans in the Medicare space we can help beneficiaries with year-round. We have other content out going through the details of this chart, so I won't take the time to do that today since our primary focus is marketing. But at the top, you have Original Medicare, which is government sponsored, and at the bottom is where you come in with an agent, either helping people enroll in a Medicare supplement with a Medicare Part D prescription plan, or a Medicare Advantage plan. When developing a marketing strategy, another key thing to think about is enrollment periods. How are you going to get your clients enrolled? It's great that you know the plans that you can enroll them in, but how are you actually going to get them signed up? So the four major enrollment periods that you'll use throughout the year, and there's more than this, but these are the major ones, are your initial enrollment period for people that are new to Medicare. You got your Medicare Advantage open enrollment period for people that have a Medicare Advantage plan that might want to do a review in the first quarter of the year. You have numerous special enrollment periods like losing employer coverage, plan having a service area reduction, things like that you could use throughout the year. And then finally, keep in mind, marketing throughout the year, you do have the annual enrollment period that we are all leading up to. So you want to make sure you have that in the back of your mind as well, but just because you can't help somebody today, go ahead and get permission to contact and call them in October, and you might be able to help them then. The initial enrollment period is a one-time 7-month window for individuals to enroll in Medicare for the first time. It begins 3 months before your client's 65th birth month, includes their birthday month, and continues for 3 months after. This all centers around the 24th month of disability if your client's under 65, so just keep that in mind. During this period, clients can enroll in Original Medicare A and B. They can sign up for a Medicare Part C, Medicare Advantage, or they can enroll in a Medicare supplement plan along with a standalone Part D prescription plan to help with their out-of-pocket cost. Missing the IEP can result in costly penalties for late enrollment in Part B and D, as well as they could experience gaps in coverage, making this an essential time to get things right the first time. Also, for you as the agent, this is a prime opportunity to generate referrals. A lot of times we are friends with people around our same age. So chances are, if you're in front of somebody turning 65, they know a handful of people that have either just turned 65 or that are about to turn 65. So you want to make sure that you're able to help these people and do it the right way. The Medicare Advantage open enrollment period, or MAOEP, runs from January 1st to March 31st each year. During this time, individuals who are already enrolled in Medicare Advantage have a one-time opportunity to make a change. They can switch to a different Medicare Advantage plan or disenroll and return to Original Medicare with the option to add a Part D plan. This period is crucial because it allows beneficiaries to make a change when maybe they found out they didn't make such a great decision during the previous annual enrollment period. They might have a surprise in January when a drug isn't covered or a doctor isn't in the network. It's a great opportunity for you as an agent to step in and save the day and get them a plan that truly meets their needs. Of course, any talk about enrollment periods would not be complete without briefly speaking about the annual enrollment period, even though this webinar is about marketing strategies for non-AEP times. But the annual enrollment period runs from October 15th through December 7th of each year. And during this time, Medicare beneficiaries can enroll in, switch, or drop their Medicare Advantage or Part D prescription plan, with changes taking effect the first of the following year on January 1st. This is a major focus for a lot of agents, and it should be in the back of your mind throughout the year. Like I mentioned earlier, a lot of agents that are high performing will be collecting permission to contact forms all the time for people that maybe they can't even help right then on the spot, but it just creates a lead for them that they can compliantly call in October and potentially pick up a client at that point. So keep that in the back of your mind, even if you're doing a community event or anything else that we're about to talk about in the next few minutes. If you can collect a permission to contact form, that is a lead heading into AEP. So you want to make sure you hang on to that and that you can call them at that point in time. Now let's talk about SEPs, or special enrollment periods. These are your year-round opportunity to helping clients who have experienced some changes and sometimes might have more of a complex situation that you can truly step in and help. SEPs are triggered by specific events like moving out of your planned service area, losing employer coverage, having a change in Medicaid or extra help status, entering or exiting a long-term care facility. The list goes on. There's all kind of SEPs and qualifying life events that could potentially help you enroll a client in a plan or get them a plan that better meets their needs. This is really your opportunity to be an expert in your field and to help clients identify certain life events that qualify them for coverage, along with proper enrollment codes to get their plans approved by CMS. A wrong code could delay enrollment, especially near the end of the month. It could be a disaster for a client who needs coverage first of the following month. So this is really where you can be an expert and help clients where they need it most. Chronic Special Needs Plans, or CSNPs, are Medicare Advantage plans specifically designed for people with qualifying chronic conditions such as diabetes or heart disease. They often feature enhanced benefits like larger dental or vision allowances, big grocery cards, and lower copays on certain prescription drugs. The cool thing and the opportunity for you as the agent with CSNPs is you can enroll people in these plans anytime throughout the year, as long as they have not used up this enrollment period in the past. Medicare beneficiaries with qualifying chronic conditions have one SEP per lifetime per chronic condition to enroll in coverage. So if you come across somebody that is not in the right plan for them, or you find a CSNP plan that better fits their needs than the plan they have, you can get them enrolled even if they have no other enrollment periods available to them. Compared to original Medicare, Medicare Advantage plans, and Part D plans, Medicare supplements work a little differently and present their own unique enrollment opportunity throughout the year. Medicare supplements do not follow enrollment periods that we reviewed earlier, but instead they have their own rules. Beneficiaries can enroll in Medicare supplements throughout the year in 3 different ways. The first being their open enrollment period. This is when they are new to Medicare or recently turned 65. Your open enrollment period, not to be confused with the Medicare Advantage open enrollment period, is a 6-month window where your client is 65 years old and has Medicare Part B. So if they're 65 and their Part B starts, their clock starts for their open enrollment period. During this time, they can enroll in any Medicare supplement of their choosing with no underwriting. Next, we have qualifying guaranteed issue rights. These are going to be things for people that are already on Medicare, like moving outside of your planned service area. Maybe their Medicare Advantage plan experienced a service area reduction, or they are recently leaving an employer plan. These qualifying guaranteed issue rights allow your clients to enroll in either Plan F if their Medicare Part A started before 2020, or Plan G with no underwriting if their Medicare Part A started after 2020. Finally, we have underwriting, and this is often forgotten. Clients can change their Medicare supplement anytime throughout the year with underwriting. They can medically qualify with a different carrier for perhaps the same coverage with a lower premium. So you not only get to save them some money, you also get to pick up a client. And the cool thing about this is most states pay full comp on all underwritten products because they know they are getting a healthy member. So anytime you're in front of somebody, even if they say, hey, I'm happy with my Medicare supplement, make sure you mention, hey, we might be able to get you that same plan G or same plan N or plan F with a different company, same exact coverage for a lower premium. So before we just let it go, let's at least take a look, make sure you're not overpaying. Now, let's take a look at some common ways that you can also help people who are under 65 with their health insurance enroll throughout the year. The Affordable Care Act, or ACA, works by giving a monthly tax credit or subsidy to individuals or families under the age of 65 who have no access to affordable health insurance through a job. Based on the individual or family's projected yearly income, the federal facilitated marketplace pays the insurance company a set tax credit each month to help pay for the insurance. The insurance company then bills the individual or family directly for the balance of the premium. Enrollment or changes in marketplace plans can happen during the open enrollment period or if the individual or family qualifies for a special enrollment period. In the federal facilitated marketplace, the open enrollment period runs from November 1st to December 15th for individuals seeking a January 1st start date, and it is also extended out to January 15th for individuals seeking a February 1st start date. Certain life events can also qualify you for a special enrollment period, so those are important to keep in mind when helping people throughout the year. For special enrollment periods through the marketplace, most applicants must request this coverage be started within 60 days of a qualifying event. They will also most likely need to submit documentation to verify this SEP as well. I won't read this slide here to you, but you can see these are some of the most common SEPs. Most of the time, if somebody moves from one state to the other, also if they lose minimum essential coverage through a job, or like you'll see on the next slide, they fall in a lower income bracket. This SEP is the largest opportunity to grow your business in the ACA space throughout the year. Any individual or family that falls between 100% all the way up to 150% of the federal poverty level has a rolling monthly SEP to either enroll in coverage for the first time or change plans if they are not where they need to be. This is a great opportunity for you as the agent to grow your book of business and help people in your community qualify for coverage who maybe didn't think they could afford it, or maybe were in the wrong plan that need to switch anytime throughout the year. Now that we are brushed up on the technicalities of enrolling clients in coverage, let's dig into the main content for today of practical ways to put yourself in front of people that need your help. Let's revisit some key marketing fundamentals that I want you to consider when crafting your marketing plan. First off, I want you to know your target audience and know them well. For you in this space, it's pretty easy. This is either going to be seniors who are nearing Medicare age or for seniors who are already on Medicare. For the ACA space, this is going to be for folks under 65 who don't have affordable coverage offered to them through work. Second, I want you to define your value proposition. What unique value do you bring to the table? For you, this is often becoming a trusted advisor and guiding clients through the complexities of Medicare and health insurance. Real simple. You want to be able to guide them through their options and then be there for them once they get enrolled. That's the value that you bring to the table. Third, I want you to choose what marketing channels you want to utilize to broadcast this message. I recommend a mixed strategy here using things like social media, community-based events, as well as building relationships with professional referral sources in your area like accountants and financial advisors. Finally, focus on your branding. You need to develop clear and consistent messaging and visuals from your logo to flyers to your verbal communications when you tell people about what you do. People need to instantly understand what you do, and they need to know how you can help them. To dig a little deeper into defining your target audience, that is going to be for people who are nearing the age of 65, over the age of 65, and who are retiring or already on Medicare, or under the age of 65 and who are disabled. The last of that category is going to be a little bit harder to specifically target, but it's still in your audience pool that you need to be broadcasting to. On the ACA side of things, it's going to be a lot broader. This is going to be anybody under the age of 65 who does not have affordable health insurance through a job. They might be self-employed, work for a small business that doesn't offer them coverage. A lot of fast food workers who are part-time might not be offered coverage, or you might run into somebody who is retired under the age of 65 and waiting for Medicare. Now let's define what your value proposition is for the clients that you help. In Medicare, you take the confusion out of Medicare while empowering beneficiaries to confidently choose the right plan by providing trusted guidance and ongoing support. In ACA, you help individuals and families navigate the federal facilitated marketplace to find affordable coverage and avoid costly mistakes. Many qualify for low cost or no cost plans and don't even know it, and you provide the trusted guidance to ensure everyone that you work with gets in the right plan and understands its benefits. Now that we have identified who you need to be marketing to and the value that you bring, let's talk about how to actually get that message out there. You need to be able to let people know who you are and what you do, because people need the help, but they need to understand that you are the one that can help them. So let's start with social media. At its core, social media marketing is the use of platforms like Facebook, YouTube, Instagram, LinkedIn, among many others, to promote products, services, and most importantly, your brand. It's all about engaging with your audience, building relationships along the way, and driving visibility for your business so people know who you are and what you do. In the technology center world that we live in, building an online presence is absolutely essential to your success in broadcasting your message to the masses. So, how do you do that? The first step is creating business social media accounts along with a Google My Business profile. This allows people to find you online. Next, you want to post on those accounts weekly at a minimum. You can see here, this needs to be a combination of either educational, storytelling, promotional, or engagement posts that we will go through the details on here in a minute. Next, ask your clients for reviews. Make sure to stay in the loop and read and respond to the feedback that your clients give you. You want to thank people for good feedback, and then also maybe adjust your process if you get some negative feedback. Having good reviews on your Google and Facebook page gives you a lot of credibility when people are searching for you online. Next, you want to join community Facebook groups. Interacting with other people in your industry and being involved in the conversation is essential for your continued learning and networking opportunities. Finally, include your social media handles on any print marketing. Clients need to know where to find you online. You're doing a lot of hard work making these posts, and you want to make sure people are actually there to read them. Within your social media accounts, you should be making 4 types of posts on a weekly or monthly basis, depending on the frequency that you want to be involved here. The first type of post is educational, where you provide valuable information to establish authority in your field and to help your customers and clients solve problems. This needs to include things like how-to guides, industry tips, infographics, and explainer videos, educating the public about the topics that they need help with. Next, you're going to have promotional posts. These highlight products and services or special offers to drive sales and conversions. Some examples here might be new product launches, discounts, limited time offers, as well as maybe new carriers or products that you're contracted with. Next, we have engagement posts, which encourage interaction to boost your brand's visibility and audience connection. These might be things like polls, quizzes, behind the scenes content, or a look into your personal life so people can know you as a person and not just an agent. Finally, we have storytelling posts, and these build an emotional connection by sharing experiences and your brand's value. They might be customer success stories, reviews, employee spotlights, company milestones, and other community involvement. Here are some real life examples of 2 different types of posts. On the left, we have promotional posts. This particular example is promoting Delta Dental Insurance. On the right, we have educational. This example is educating the public on 3 tips to avoid Medicare fraud. There's a lot of fraud in the industry, so this would be a great thing to display on social media so your clients can be aware and not get scammed. Next, we have engagement and storytelling. So on the left is an awesome example of an engagement post that we did here at Lori Life and Health. It was National Dog Day, so everybody had to bring their dogs to the office, and we just had a lot of fun. So we wanted to let the public know about other things we do other than insurance, so they see us as people and not just a business. We want the public to see you in the same light. On the right is a storytelling post. So LaPortia from our office had an awesome review that we wanted to share. If you are getting reviews from the public on Google and Facebook, you need to be sharing these on your page as well, as it can build a lot of credibility within your brand. The next marketing channel I want to talk about is grassroots and community-based strategies. A lot of times our backyard can be overlooked, especially in the age of technology where we want everything to be automated and online. You've nailed down your social media profile and Google My Business account. Now it's time to really get involved in your community so you get some boots on the ground and let people know around where you live what you do. What really is grassroots marketing? Grassroots marketing is getting involved in your local community through things like Chamber of Commerce, community events, food or nonprofit distribution centers, service organizations, recreation centers, faith-based organizations like churches or synagogues, or maybe you're involved in your fraternity or sorority alumni associations. It's really a way to create visibility more than anything so people in the community and organizations you're involved in know what you do. The major key to success with a community marketing and grassroots marketing strategy is knowing what's actually going on in your community. When are health fairs happening? When are empowerment expos going on? Maybe there's a classic car show you want to set up a booth at. Maybe there is a local annual community event. In the town I grew up in, we had an annual event called the Acorn Festival. There were many businesses that set up tables and booths there. It would be a great opportunity to set up with a sign that says, have questions about Medicare or questions about health insurance. I guarantee you, if you did your table the right way, people will come up to talk to you. And it's an awesome way to build brand visibility and potentially generate some leads at a pretty low cost. Are you new to your community and maybe don't know all the ins and outs of what's going on? You should ask. Ask your clients, what are some festivals or events that you and your friends like going to that I should be at? Google community events in your local city or state. Just because it's not in the town you live in doesn't mean it's not a market that you can go after. So get online, do some research, and let's go set up some tables and build some visibility to your brand. Within any grassroots or community-based strategy needs to be T65 marketing, and this can be done two different ways. You definitely want to be posting on social media. We've already talked about that. But at a grassroots level, I want you to be doing Turn 65 events, whether it's at your local library or maybe a restaurant. You can advertise those in a variety of different ways through mailers, social media, flyers, or simply just word of mouth. Once you build some nice reputability in your community, people will know when these events are taking place each month. Also, in addition to this, send out T65 cards, but don't do it the way most agents do it. I want you to create a nice drafted letter and handwrite every single envelope. It creates that personal and community touch that people are looking for, and they are way more likely to open your letter about turning 65 and give you a call. Now, you want to be sending these out anywhere from 3 to 7 months from the time they're turning 65. Competition has gotten pretty fierce in the turning 65 market, so you have to get out in front of other agents if you want to be able to capture this business and create a client for life. Under the T65 marketing, I know I mentioned events. So events are, I think, the way of the future. Direct mail leads simply do not work the way they used to. Response rates have gone way down due to saturation. So educational and sales events are the way we've seen a lot of agents pick up business over the last couple of years. Now, you can do these at restaurants, libraries, churches, community centers, as well as a wide variety of other locations. And you get people there by word of mouth, posting flyers and signs, or even direct mail if you want to make a larger investment. Now, let's talk about some best practices for these events, because there are a lot of compliance guidelines that go around event marketing. So when it comes to compliance, what you do want to do at your events are discuss educational materials and Medicare. Just discuss what's original Medicare, what's a Part D plan, what is a Medicare Advantage plan, what's a Medicare supplement, how do you get signed up. There's all kind of other questions that you can answer here without talking about specific plans or specific benefits. If you're doing an educational event, also go ahead and serve a meal. It's going to get people to your event. If you list that on a flyer or a mailer, people are way more likely to attend if you are serving a meal for your event. Just keep in mind here, it can only be $15 or less per person. For the people that attend, go ahead and get permission to contact forms filled out. As a reminder, you cannot call people that attend an event just because they came. They do have to give you express permission to give them a call, which we can get you some permission to contact forms so you can compliantly gain that consent. Go ahead and follow up with these attendees the next day that filled out a permission to contact form to set an appointment. Even if it's somebody you're not sure that you can help, it does not hurt to go ahead and set an appointment, have a conversation with them, as you may be surprised at the situations you'll run into. Be creative. Events could be as simple as sitting in front of a grocery store with a big sign. They do not have to be very formal. Now, a lot of agents that have had success are doing formal lunch and learns or dinner and learns or coffee and donuts. There's a lot of different options here, but an event could also be as simple as going to a grocery store on a senior day, setting up a table with permission to contact cards and a big sign that says have questions about Medicare, and picking up some leads. So that's what you want to be doing. Now, what you don't want to be doing on educational events specifically is talking about specific plans and benefits unless it's filed as a sales event. So you can't talk about dental benefits, zero premium, that kind of stuff unless it is a filed sales event, and you have to do that with a carrier, which we can help with. You do not want to answer specific personal questions. If someone has a complex situation that they've ran across in their Medicare journey, unless you think it would be for the good of the group, make sure you bring that offline afterwards. You can't serve a meal or give gifts if it's more than $15 per person, unfortunately. And in fact, if you're doing a filed sales event, serving a meal is off the table entirely. You're not allowed to do it. You can only serve a meal at an educational event. Now, the next thing you don't want to do is get a scope of appointment filled out at an educational event. You can get it filled out if it is a filed sales event, but you cannot get a scope of appointment if it is simply an educational event. Next thing you don't want to do is call attendees that didn't fill out a permission to contact form. So if you call people without permission to contact, that is a pretty big CMS violation, so you do not want to do it. But go ahead and encourage people to fill those forms out at the event so that you can give them a call so they can potentially turn into a lead. Don't get lost in the details either. It can be a lot of work getting these events set up, and sometimes you just have to get out there and do it. Like I said, it could be as simple as setting up a table at a grocery store, an accounting firm, or a doctor's office that'll let you. So don't get lost in the details. The activity breeds activity slogan that Joel always likes to say is a big thing here. So you got to get out there in the community and do some events. So here's a real life example of what our partners over at Grand Anchor Insurance recently did at a local health fair. You can see they set up a really fun table. They gave people a reason to come up and talk to them. And that is the key when you're setting up at a vendor fair. They are actually able to get a lot of permission to contact cards from this. So as you can see, it does take a little work setting up, but it was very much worth their time as they created some more brand visibility and generated some leads for their business. Here's another example of one of our awesome agent partners, Jennifer, setting up at a local health fair as well. You can see here's just another example of what your table may look like. You can see she was actually raffling off a gift basket to get people to come up and talk to her. And that is a key. You want to have a reason for people to come up and say hi and ask about who you are and what you do. So those first two examples were informal vendor style events. Here's an example of Jennifer doing an educational event where she was telling people about the ins and outs of Medicare. You can see on the slide she's currently at, she was talking about enrollment periods. So she was educating the public on what Medicare is, how it works, so she could go around afterwards, answer individual questions, collect permission to contact forms, and potentially help some of these folks in the room navigate their own plan and pick up clients. All right, so we made it. The final marketing channel to talk about is referrals. Don't forget about referrals. Let's dive into the details. The first type of referral sources I want to talk about is professional referrals. And professional referrals is definitely a key strategy that you should be using for your business to foster mutually beneficial relationships with industry professionals who can recommend your services to their clients. These places might be medical offices, pharmacies, public health clinics, financial firms, or accountants. The list goes on and on and on, and a lot of times it's based on your local community and who you know. Now, to develop these relationships, it's probably going to be a little bit uncomfortable to start with. A lot of times, let's say if it's a financial advisor's office, it could be as simple as you just walking in the office with some rack cards and flyers, having a conversation with whoever is at work that day, explaining who you are, what you can do, and offer yourself as a resource for their clients. You want to provide value through educational content, collaboration, and co-hosted events where maybe they bring some of their patients or clients with them, you bring some of your clients with you. You talk about both industries. They pick up some clients from you and you pick up some clients from them. So it's all about being consistent and offering yourself as a resource and educating them on who you are and what you do. Another great source of referrals from you can come from your own existing book of business. And this is done by staying at the top of your clients' minds throughout the year. So when their friends and family ask them about what covers they have or what they did with their Medicare health insurance, they can answer that, but then they will also think of you. So you could potentially get some calls. So practical steps to stay at the top of your clients' minds is by sending them a handwritten thank you card within 30 days of enrollment, sending them a newsletter in the spring and the fall. Of course, seasonal or birthday greeting cards are a great way to stay in front of them. And then definitely give them a call or do an annual review each year for their policy. Finally, let's make sure you're giving yourself some referrals. Referrals to yourself could come from your existing book of business in either life insurance or ACA that are turning 65. You want to make sure you're mining this data and contacting anyone who has a 1961 birthday or earlier, 6 to 7 months before they turn 65, so that they can be doing what they need to do to start their Medicare, and then you can be the trusted advisor to help them get enrolled. When it comes to referrals, as I mentioned, becoming a trusted advisor is the number one way to get your clients talking about you when people ask them about health insurance and Medicare. So, what is a trusted advisor? A trusted advisor has a consultative, needs based approach to their meetings and appointments. They really look at what their clients need, not just what they think their clients need. They listen and they hear when their clients have something to say. Next, they are portfolio minded. They don't offer just one product or one carrier in their segment of the market. They offer all the solutions so they can look at dental and vision if they're helping somebody with a Medicare supplement, or fill in the gaps with a hospital indemnity plan if they are assisting with a Medicare Advantage. Finally, they develop relationships with their clients and they stay in front of them. This can be done through a drip marketing campaign like we talked about earlier. Next, how do you become a trusted advisor? You do those things we just talked about. You educate your clients on all their options because you are portfolio minded. You have all the options. And then you also hear about their needs. Next, you provide superior customer service. You are there to answer your clients' questions after enrollment when they have an issue with a bill or a question about their plan. You take their calls, you return their calls, you provide better customer service than they have experienced with any other business out there. Next, finally, I keep saying this a lot, but you stay in front of your clients. The drip marketing schedule that we had a couple slides ago will do just that. Now, finally, for you as the agent, what are the benefits of becoming a trusted advisor? This separates you from the competition. There's a lot of agents out there that help clients to get enrolled, then they're never heard from again. A lot of agents out there also have a preconceived notion of what their clients needs before they even let their client talk. Don't do that. Listen to your clients and offer all the options. Next, you want to develop your reputation within your community. This can be done through social media, through grassroots strategies that we talked about earlier, but people need to know who you are, what you do, and develop a brand for yourself that is solely centered around helping people. Finally, the best benefit of this is it's going to generate you a lot of referrals. We have a lot of agents that have been marketing and doing business like this chart says for a number of years, and fortunately at this point they really don't have to do any marketing. They grow organically each year strictly off word of mouth, and referrals. So follow this chart, follow this model, and you will find yourself in the same situation. Now that we have identified your target market, talked about your value proposition, and identified certain marketing channels to get your message out there, let's talk about your branding and how you can use that to further communicate your message and get in front of the right people. Branding is extremely important when it comes to marketing because you want to make sure people know what you do. It needs to be very clear, very precise, very specific on how you can help people with what they are struggling with health insurance and Medicare. From your logo to the language on your rack cards, flyers, and business cards, we want to make sure that you have it nailed down so when people see your materials or see your posts on social media, they understand who you are, what you can do, and how you can help. Other than the communication on your print materials and your branding, the way it looks is really important as well. We want you to have a really good looking logo. We want your colors to flow together. We want your social media posts to be eye-catching to stop someone's scroll. That is really where we come in to help at Lori Life and Health. On the previous slide and this slide, these are some examples of materials that we can brand specifically for your business so that when someone sees your rack cards in a pharmacy or doctor's office or your social media posts on Facebook, they stop their scroll, they read about what you have to offer, and potentially pick up a client or grow brand awareness from there. Finally, before I let you go, let's talk about some Medicare marketing compliance reminders. As you know, this is a highly regulated space. There is a lot of stuff that you can do, but there's also some stuff that you can't do. So I want to make sure that all of y'all know what the rules are around marketing so that you're staying compliant and you can have some longevity in this business. When it comes to Medicare marketing compliance for Medicare Advantage and prescription drug plans, there are really 5 key points I want to cover today. The first is these requirements apply to all third-party marketing organizations. And third-party marketing organizations, also short is TPMO, are agencies like Lori Life and Health or independent agent partners like yourself. Also, all marketing materials need to be submitted and approved from all of your carriers before you are allowed to use them. Recently, a newer, broader definition of marketing that expands the types of materials, including in this category from CMS, has been announced. Agents must also now display proper disclaimers on all communications and marketing materials. We'll talk about that a little bit more. And then finally, as a reminder, you as an agent are not allowed to specifically market for the Medicare Advantage open enrollment period, which we'll talk about more here in a second as well. So what is this broader definition of marketing? First off, it applies to any marketing materials. That includes things like print, digital, TV, radio, websites, or direct mail, and they must be CMS and carrier approved now. This definition of marketing is any material referencing benefits such as zero premium or low copays, dental and vision, hearing included, gym membership, grocery cards, the list really goes on and on. After these materials are approved, you will receive a multi-plan ID which must be included in the footer of the materials. So as you can see, it's a little bit of a process now to be able to use a quote-unquote marketing material, which is any kind of material that mentions a benefit. Now, generic materials, also known as communication, do not need to be approved, and they can talk about generic Medicare information, have something that says like questions about Medicare, the types of products that you represent, but they don't talk about benefits. That's generally what we recommend just for ease of use, and it still gets your message out there. They do not need to be approved. As far as required disclaimers, these need to be on all marketing and communication materials. So even if it is just a generic communication material that you did not have to get approved by all the carriers you work with, these disclaimers still need to be on there. They also need to be listed on your website and your email signature as well. So the first thing is your TPMO disclaimer. By now, I'm sure many of you are very much aware of this, but that is the disclaimer of we do not offer every plan available in your area. I won't bore you with reading the rest of it, but as you can see there, that needs to be on your website, communication materials, marketing materials, and email signature. The next thing is your office hours. CMS recently came out and said office hours need to be listed on all these things as well. Finally, if you have a phone number on materials, website, or email signature, TTY 711 needs to be next to all phone numbers, and all these things need to be listed in clear, easy to read font. Finally, The Medicare Advantage open enrollment period is a phenomenal time to grow your business and help clients who may have made a mistake during the annual enrollment period. But as a friendly reminder, you are not allowed to specifically mention the Medicare Advantage OEP or specifically market for it on your materials or social media posts. Now, you can talk about the Medicare Advantage OEP if a client reaches out to you and wants to know what they can do about their plan. You can talk about it then. It just can't be on your materials. Also, if you're doing an educational event, you can mention the Medicare Advantage open enrollment period as well as you are also talking about all the other enrollment periods available out there as well. Compliance-wise, what should you do now? Here are a few simple steps you should take immediately if you're not already doing these things. The first things are make sure you go ahead and add that TPMO disclaimer to your website, to your email signature, and any marketing or communication pieces that you may have. Next, you want to make sure that the materials that you're using as far as rack cards, business cards, flyers, social media posts are still considered communication pieces. Make sure they're not mentioning any specific benefits, and if they are, make sure you go ahead and get those approved so you're staying compliant. Remember, all marketing materials and sales scripts must be submitted for CMS approval. So if you want to continue to use these things, get with us. We can help you get them submitted and approved. Another next step when it goes back to the marketing piece is creating a plan. No business is ever going to be as successful as it could be without a plan that is written down on paper that you can refer back to when you're not sure what you need to be doing to continue to grow. So what is a marketing plan? I want all of you to go look at your production from last year. I want you to set a new production goal from this year, no matter what time it is throughout the year. It's never too late or early to do this. Go ahead and set a new goal for this year. Think about the territory and the target market which you're going after. I want you to nail down your value proposition. I want you to think about what value you bring to your clients. I gave you some examples earlier, but what value do you personally bring to your clients? I want you to consider the marketing strategies that we talked about today. And finally, I want you to formulate a budget and a plan to help you generate enough activity to reach your goals. After you generate this plan, I want you to be honest with yourself. Go back and look at the goal that you set for production and be honest and tell yourself if the activity that you're going to be producing through the plan you've created is actually going to get you there. If you do all those things every year, year in and year out, you will continue to grow. And most importantly, make sure you have fun doing it. Thank you so much for attending today's webinar. I hope you have been able to take some logical next steps from today's presentation to implement in your business to continue to grow throughout the year. Before I let you go, I have one question for you. Who do you want to partner with? I sure hope it's us here at Lori Life and Health. And if you are not currently one of our agent partners and want to learn more about how we can help you grow your business, please give us a call at 803-256-2067. Once again, that number is 803-256-2067. Thank you so much and have a great day.